I want to kind of hone in a little bit more on some of the specific populations that we work with and some of the challenges that we've seen there, and also some of the really unique opportunities that have come from it. So for those of you who've been working with search for any period of time, you know that we like to innovate, you know that we like to consistently improve the things that we're doing. We try new things. We constantly want to improve our outcomes in the work that we do. And there's been some really beautiful things that have come out of this pandemic. There really have. So I'd like to highlight some of that. And let's start with the unsheltered clients. So on outreach and the individuals that we're serving on the street, Jonathan, can you say a little bit more about some of the unique challenges and opportunities that we've seen through this?
Absolutely. Yeah, well, as we started to see those barriers increase around basic needs, the community wanted to respond to the pandemic, and search felt very strongly that we should respond, but we should have a cohesive plan. If we're going to repurpose our staff for this new situation, we want to be on the same page with all the other outreach teams and do something that's impactful. So we were able to get the outreach teams across the city coordinated to break out the city into sections to focus on 3 specific tasks. One was health education, just making sure everyone had up-to-date information because of the real presence of misinformation. Make sure that we understood the needs in terms of food and hygiene and that we were able to distribute those supplies. And make sure that people had an avenue to self-quarantine if that was appropriate to do. And so we took the region kind of, it's like a donut of the city, like Bellway 8 down to the center of the city. The center of the city was taken by HPD homeless outreach team, and outside Bellway 8 it was the Sheriff's Department's homeless outreach team. And so starting this coordinated effort, we were able to get out there and really connect with the folks who were just trying to figure out how to get by and work through these things. We did screen several people for the quarantine option. Our team did not actually find anybody who was tested positive for COVID so far. And the clients that we interacted with were actually very receptive. People wanted supplies. People wanted to learn the right practices in terms of social distancing, to use sanitizer and masks. And so we've had a positive experience spreading the word and getting those supplies out there. And at the same time, we wanted to figure out also, how do we stay true to our mission? Because our normal work, even on outreach, is about getting people into housing. And so we were able to pivot a couple of our practices to make our housing process work more remotely. We were able to get the housing authority on board with virtual inspections, with virtual briefings, which are essential to moving through our process. We're able to pivot the way we get referrals, because normally folks in the system for housing are waiting for a unit to open up. And we just went ahead and started seeing who can we contact who's on the list to establish contact, but also build their case so that they're ready to go if a spot does become available. We knew that finding folks was going to be hard right now, so we thought, yeah, let's go ahead and just get everybody that we can and keep things moving. And it's been a great success. We've housed around 20 people during this shutdown, so the fact that we're still cranking along and gaining momentum as we speak is pretty exciting.
Yeah, 20 people housed in any period is remarkable, but I mean, really during this period specifically, it is unbelievable. I think when many of our operations kind of needed to screech to a halt, and a lot of these systems that rely on other partnerships and other organizations, we were really concerned that we may just see a complete halt to people moving in. So it's exciting that it's continued. I think it's really important. We continue to hear and kind of echo the sentiment that housing is healthcare. and we're in a healthcare crisis, right? So getting people into housing is really important. So glad to have our partners on board with helping us do that, and of course to our teams to being able to continue that work. It's exciting.